An insurance agent meeting with a woman shopping for insurance in Miami on November 1, the first day of the open enrollment period for the Affordable Care Act. Joe RaedleGetty Images Washington. More than 600,000 people signed up last week for health insurance under the Affordable Care Act, significantly beating the pace of prior years as consumers defied President Trump's assertion that the marketplace was collapsing. In a report on the first 4 days of open enrollment, the Trump administration said on Thursday, 601,462 people had selected health plans in the federal marketplace, HealthCare.gov. Of that number, 137,322 consumers, or 23%, were new to the marketplace and did not have coverage this year through the Federal Insurance Exchange. It's the biggest start to open enrollment ever, said Lori Lodes, an Obama administration official and co-founder of Get America Covered, a nonprofit group helping people get information about insurance options. It shows that people really want to get health insurance and value it. The surge in sign-ups came after Mr. Trump and Republicans in Congress had repeatedly tried to repeal the Affordable Care Act, warning that markets were imploding and rates exploding. Obamacare is finished, Mr. Trump said at a cabinet meeting on October 16. It's dead. It's gone. It's no longer. You shouldn't even mention. It's gone. There is no such thing as Obamacare anymore. The numbers tell a different story. Sign-ups averaged more than 150,000 a day last week. By contrast, they averaged 66,000 a day in the first week of open enrollment in November 2014 and 77,600 a day in the first week of enrollment in November 2015. The Obama administration reported data every other week last fall, and the first report showed that sign-ups averaged 84,000 a day. Ms. Lodes suggested that consumers, anxious and confused about coverage, visited HealthCare.gov last week and found that health plans were cheaper than they had expected. Insurers have raised the premiums for many health plans in 2018 because of Mr. Trump's threats to cut off certain subsidies paid to insurers. As a result, many consumers with low or moderate incomes were eligible for larger tax credits to help pay the premiums. Many consumers are therefore able to buy similar health plans or more generous plans for about the same price as last year. Republican attacks on the Affordable Care Act appear to be fortifying support for the law. The new report came 2 days after voters in Maine approved a ballot measure to expand Medicaid under the health law, and a Democrat swept to victory in Virginia in a governor's election in which healthcare was a top issue. The sign-up period for the federal exchange ends on December 15 and is about half as long as the open enrollment seasons in each of the last 3 years.